Okay, I think we'll get started. I am Steve Tratner. Hopefully, most of you are familiar with my droning at the beginning of all of our presentations. I'm president of AHCP, which is a subsidiary of Allstate Insurance. I'm going to go out on a limb and bet that none of you have ever heard of Lyric Health, at least prior to receiving our emails about this new Allstate plan. Lyric is the new brand for My Telemedicine, which has been a driving force in the telehealth industry for the past 11 years. I know them well since they've been the provider behind some of our telehealth benefits going back almost that long, about 9 years. Today, we have, I'd say, over 100,000 members with Lyric, which is just a tiny subset of their nearly 5 million members, if I had that number correct. And though we initially started with the standard urgent telemedicine, where you need to consult with a doctor immediately, even if it's 2 o'clock in the morning, whether it's an ear infection for your child or a really bad strep throat and you need medicine right away, that's where a lot of telemedicine companies got their start. Allstate and Lyric have teamed up to bring one of the most comprehensive telemedicine plans to the individual consumer market. This plan includes urgent care, virtual primary care, behavioral health, dermatology, pet health, specialty referrals, labs and diagnostics, and prescriptions. And the power of having a huge company like Allstate behind this plan is that it allows us to deliver this all for less than what most telemedicine companies charge for just an urgent care benefit alone. Emily James and Wayne Orchard are with us today from Lyric. Emily James is Lyric's Senior Account Manager for the Allstate Telehealth Plan. And she's going to tell us everything we need to know about how the plan works, how simple it is to sell, how you can actually send enrollment link to your client if you like, to make it super simple. And without further ado, I'd like to welcome Emily.
All right. So Wayne will be taking over and talking about our services. I am, again, Senior Client Manager for Lyric. I do all the onboarding and implementing. And so if you ever run into an issue, I would be your first point of contact. But with us is Wayne, and he'll be taking over and talking about our services.
Yeah, good morning or good afternoon to you. My name is Wayne Orchard. I am the Executive Vice President and Partner of Lyric Health. I'm happy to present today, which let me get to that information here, start sharing. So we're very pleased to have a partnership with Allstate Health Solutions. We're bringing you a different way in order to do virtual care. What we are on the path to do is to take care of someone head to toe on a virtual basis, which means instead of somebody having to deal with brick and mortar and traffic and all the headaches that go into trying to get into a doctor, well, we certainly can do this right over the phone. If I can sit there with my Samsung or my iPhone and buy a house in Hawaii without ever leaving my house, well, why can I not do that with my healthcare? So we've taken this model, as Steve said, from the urgent care episodic, where you have your cold, cough, flu symptoms, and be able to do a one and done type of doctor scenario, is to now drive into the virtual care of primary care. This is going to be able to integrate labs. This is going to be able to do behavioral health, dermatology, have a care team that follows up, with you. I think you and Steve had talked about even your pet care is now going to be able to be done virtually. So with the virtual primary care, we want to show the entire package that you have and your key benefits, right? So your urgent care is your 24/7, 365. That is always going to be there available to someone who is at home, at work, or traveling. Your primary care is now you're selecting the physician in which that you want to see not only the physician that you want to see, but the date and time you'll be able to select. Your behavioral health is for short and long-term care. You have master level degree counselors that you're able to get to on a crisis management basis, or to be able to have ongoing sessions. However, we do know that you have a counseling sometimes only gets you so far, right? If you have to now go into therapy, well, that's a gap in care. So we also have psychologists and psychiatrists that are available, to a member. Dermatology is, I use it myself for my teenage daughters, just because they're active in sports, and so a lot of things that pop up, like a skin rash or poison ivy, I can handle that on a urgent care or primary care basis. But things like acne that's ongoing, then that's where you have a dermatologist able to see a person and be able to get that under control. Now, your care navigation and care coordination, these are two different things, right? But we wrap them all up into one, because care navigation is to help somebody, with how someone can use insurance with their program, how to go if they don't have any insurance. What does a cash pay mean? How do I get a discount at a hospital? If I need specialty care, how do I do that? So when really, that care navigation is to help simplify the process. Care coordination is to help with the gaps in care. The gaps in care is going to be where we have the ability to follow up with the members and make sure things are done. So there's two gaps in care in which that we believe that we're able to fill, and that is treatment adherence and medication management. Treatment adherence is, we know if someone goes in to a brick and mortar and gets a lab request, that less than 50% of those actually get done. Well, why is that? Well, again, it's because it's an inconvenience and there's no follow-up from the doctor's office. However, with our VPC program, we are putting a care coordinator on the phone with the member to ensure that that lab gets done. And with each of the primary care services, you have an annual wellness exam that's free, and they also will receive a free lab panel for themselves and the spouse. So with that, you're going to be able to get those underlying conditions that normally the only time that that a person has is when they're an emergency room visit, and now you're $50,000, $100,000 into claims when you could have gotten this under control ahead of time. So that care coordinator really helps out in making sure that follow-up appointments are made, so that way refills don't lapse and that someone gets off medication. Right? So we really are bringing the care to a person, not making the person go follow care. Our pet telehealth, it's called Go Lexi, is a brand out there. And if you go out to golexi.com, they cannot buy this themselves. There's no consumer way to buy this. The only way they're going to get this is through the Allstate package. So this is access to a dedicated team of licensed veterinarians 24/7. Right now, this isn't, to try to avoid a veterinarian for diagnosing or treating or prescribing. This is really to get advice of care. Again, a personal experience that happened to myself is where this was built off of. That one of my small dogs had taken a pill that was supposed to be for one of my big dogs, and luckily, I've got a friend from church that was able to take my call. That is a vet, right? Well, this was on a Saturday afternoon. Normally, I would have, if I didn't have that relationship, I would have had to run off to the emergency vet to try to figure all this out. Gave me a home remedy, was able to take care of it at that time. So, this is another way to save time and money for someone's care. Now we'll dive into some of the things on the back end that typically, you don't see as far as like the integrated labs, our prescription program. And of course, we just talked about our dedicated care team. So labs is a big thing that we have partnerships with LabCorp and Quest Diagnostic. In some states, we actually have mobile phlebotomists that can come to the home or work and do a draw and get a lab panel that is, takes care of the complete metabolic panel. If you see that, it says nationwide pricing, examples, right? That is someone that you're going to see on a basis of what retail is. We have direct contracts that we essentially pass all the discount savings to the member. So someone's not going in and spending hundreds of dollars on our labs. We don't, unlike doctors' offices, that's not our key, is trying to make money off of labs. We're just trying to provide a service to uncover those underlying conditions so we can get treated, right? Now, once someone is treated and is on a prescription, well, how do we save them money there? Well, we have a program that saves up to 85% on brands and generics over 60,000 pharmacies. This is also done via the mobile app that someone can go in, show a virtual card to the pharmacist, and based off of that prescription, they're going to get the lowest price guaranteed that day. If they want to do a home delivery, they can do so and save even more money, and that comes with free standard shipping. And last thing is our dedicated care team. As we said, that is our care coordination. That's the glue that makes everything stick and make sure that we ensure that that member has a pleasant experience with the doctor and any treatment going forward. Now you see here that you have two different plans in which someone can sign up for. We have the individual plan is $39.95. So that's going to be just that primary member. But more than likely someone is going to have a family. So for only $10 more, they can include a spouse and up to 6 dependents on there. And on top of when the member comes over to us, they're able to now add in that dependent in the household that they have. So only thing that you have there is that we do not handle infants, right? So anything under 2 years old is something that is more hands-on. Other than that, over 2 years old, then they can add someone in there and we can handle all of their treatments, prescriptions, behavioral health, again, dermatology, whether that is our 24/7 call center, whether they go online to the website, or the third and most popular is through the Lyric Health mobile app. We will engage with the member, making sure that seasonal things like vacations or flu or back to school, that they always will receive information on how to use the program when they need it most. So Steve, that kind of goes over the plan. Do you have certain questions or something that I did not get to?
Yeah, just a couple things. Obviously, anybody who wants to get contracted can go to the AHCP website, which is ahcpsales.com. Go to the carrier page and look for Lyric. But I wonder if you want to quickly show them, without going into any real detail, how easy it is to enroll a customer or to send a link to a customer. Do you have access to an agent dashboard?
Yes, we do. Sorry, we were trying to figure out our muting system here. All right. Can you guys hear me okay?
Sure can.
Okay, perfect. All right, so I'll be sharing my screen here. And I will show you how easy it is for you to be able to send that link out, or even if you wanted to be hands-on and register those memberships for yourself. So let me log in. And
It's shared.
Not yet. Okay. It's not letting me open it. Okay, there you go. Okay, so upon sign up, everyone will have access to a dashboard, right? A very quick and easy, easy to the eye, for you to see what or who you have, how many people you have enrolled. Sorry, I've had too much coffee. How many people you've enrolled, and quick and easy access to basically copy your link, which would be here, or you can easily enroll someone through this dashboard as well. So I'm going to go through both options. First option is going to be the enroll new member here. You will select which plan design you will be giving them, whether it's a single or family. You will provide all the demographics. Keep in mind, I know that you see email as an optional here, but that is very important for you to collect from the member, as this is how we will encourage utilization and make sure that they have access to their own portal, right? Their own member portal. So once you fill all this out, you have access to select when that member goes effective, whether that's the same day or if they want to start in a future date, right? You will be collecting the credit card information, and as soon as you receive that, you will hit save, and the member will appear here. Excuse me. There you go. And upon sign up, whether you made that effective date today or if you made it in the future, let's say you sign someone up today, that member will receive a welcome email immediately that will give them access to their own member portal. And I will show you guys what that looks like here in a little bit. Okay. The other way that you could do this as well is by either everyone's going to have a unique link here. Okay, so you can share this link within an outreach email that you may be doing, or you can easily access it through here, right? And you can demonstrate what the benefits are and what they will be receiving if you're in person. Okay, let's say that you went ahead and wanted to sign them up. It'll be easy to just click the sign up button here. You select which plan design once again, and I'm just going to go with family. And you will fill out all the information just like you did in your dashboard, collect the credit card payment, hit subscribe. And again, that welcome email will be sent out to the member. Okay, let's say this member does sign up. They're needing to also update their credit card payment. Our care team has access to update those credit card payments, but you will also be given access to update that information if need be. Okay, so within this dashboard as well, you'll be able, like I said, to manage your members by just clicking manage members there. You can update their email, you can update their credit cards, any demographics that may need to be updated. You'll also have a full library of marketing collateral. And the cool thing about this is that you can actually download these pieces and it'll autofill your information based off of how you were enrolled by the agent team. So once you hit download, I will show you kind of what that looks like. If I can get to it. Steve, can you see that PDF there? Okay, perfect.
Yep.
All right. So you'll notice that, let me move my things around. Down below, it'll basically autofill your information, which would be your first and last name, your phone number, your NPN or NPI, sorry, and also your, no, it is NPN. Yeah, NPN, sorry, and your email here. Okay, so you can quickly, sorry about that. You can quickly download that, send it over, or you can print it out, hand it out. whatever method you prefer. And let me go back. Okay, and you'll have access to what we call the virtual primary care or just urgent care, dermatology, behavioral health, or the pet care services, whichever one it is that you want to download. The other cool thing about this dashboard is that you'll have access to reporting. So on a monthly basis or on a yearly basis, you'll be able to run utilization based off the members that you have signed up. And I'm going to quickly show you what that looks like. Okay, you would select this group here. All right, now this will tell you how many members you have enrolled, whether it's a primary or a dependent. During the consultation, members do get asked, you know, if they didn't have this service, what would they have done? One of the answers can be PCP, urgent care, emergency care room, or nothing. And based off those answers, we will tally those up and give you a total cost savings. We'll even break it down to how many visits had a consultation, a prescription given, and the top 5 prescribed medications. We even break it down by state, gender, age group, day of the week, time of the day, and then you'll be able to see the year-to-date information that's above down below. Any questions so far on this dashboard?
Just a quick comment here. What you might have noticed on some of the prior screens, although this is an individual product, meaning you could sell it to individuals and their families, you can also enroll groups. So if you do have a group with a single payer, you could add those as well under the group management tab on the left.
All right, so I'm going to quickly show you what the member experience looks like. Again, these members will receive a set of emails, one on the first day, letting them upon sign up, which is, hey, activate your account now. One on the third day, making sure that they are aware that they have this service, encouraging them to sign on. And once again, on the 7th day, just encouraging that sign on and activating their portal, and then ongoing engagement throughout the season. Okay, I'm going to stop my share for just a second so I can log into a different portal. Okay. How do you stop share? There we go. Okay. Wayne is going to be taking over and logging into the member dashboard. So I'm going to go off mute.
Okay. So once a member comes in, it's very unique to that membership where they're going to see their name right up here, and it's going to be all tile based, right? And so whether they have the individual plan or family plan is what's going to be laid out and how the member will be able to proceed. As you can see, any information as far as copay or consult fees will be right here in the administrative dashboard, in the member dashboard, right? So you can see your urgent care is no cost. Your virtual primary care has no cost. The dermatology, you'll see it says promotional discount because the first 3 visits of the year are free. And then each one after that is $65. The behavioral health counseling is free. Now, if they go to the next level of care into therapy, there's a fee for each of the visits to psychology and psychiatry. And again, the Go Lexi Pet Telehealth shows as free. So as a member comes in and establishes their, what way they want to go, whether that's urgent care or virtual primary care, they can actually say, when do I need to use this? They'll be able to find out, all the different information, kind of like dermatology. You would think, again, that's something that, skin rash or poison ivy or something like that I would need, when in fact that doesn't fall under that, right? This is, for your chronic dermatology conditions. So let me just real quick go through what a virtual primary care visit looks like. So if I select the person that in which the consultation is for, again, if I have a family plan, then I'll show all my dependents under myself. It'll ask me what state I'm in, so that way our physicians are licensed in that state are available. In the today's visit, someone can put in, annual wellness. Someone can put in the sick. They can put in, whatever it is. And again, this is the intake. This is taking that brick and mortar feel and put it into a virtual concept. Do I need to require any prescriptions on my refills? Again, this is just setting the doctor up and the care team up to know what kind of visit this is going to be. I'll say no. Right now, here's where again your normal telehealth is. I'm just going to get a call right back from a doctor that's licensed in my state. Well, this time I'm going to be able to select a doctor based off of their demographics, based off of their information in which they're going to be licensed in. So I'll go down and here, actually, let me go up and I'll show you, say, oh, I want to make an appointment for next Monday. I'm going to be able to see the availability, right? So there's no times for Dr. Quinn. However, if Dr. Quinn is already established as my primary, I can go and request a time in case I want to try to get fitted in. But let's say Dr. McKee, I'll go in 3 p.m. One click of the button, I am set up for Dr. McKee Monday at 3 p.m. for Dr. McKee to connect back with me. I don't need to know, I don't have to worry about when are they going to call me, or I'm going to have to sit in a waiting room for hours. There's probably about a 5-minute window, right? I mean, no one's perfect on their time in there. So, give a little grace on the window time of being able to call back. But typically within that 5-minute window, they are getting connected with that doctor. So we follow the rest of the intake. Do they have allergies? Do they take any medications? Any medication conditions that we need to know of? Any surgeries that they need to report? Height and weights. Now here's where our health risk assessment comes in. Again, this is a difference between urgent care and virtual primary care. Virtual primary care, we're worrying about everything with their surroundings, right? How much exercise are they getting? What kind of food are they? Fast food eating? Are they sleeping enough? What kind of stress do they have in their job? So once that they have filled out all the information, which is just 25 questions, it'll take them roughly 4 to 5 minutes to go through all this. And once they have it filled out, then they click next. So once they click the next on it, the next time that I come in and select a primary care visit with Dr. McKee, it's not going to ask me to fill that out again. It's going to ask to review and if I need to change anything. So if this is my first time coming in to the consult request, I'm going to set up my preferred pharmacy. So if I go in and I can select a pharmacy, I can go in and just do a Google Maps and find a pharmacy right next to me. Maybe I want a 24-hour, maybe we can expand this out. Once I hit select pharmacy, that will set it up as my preferred, and I can change that at any time. Now it's going to say, when the doctor does call you back, or we need to send you a message, what number can we reach you on? And then I give my consents. And now I get our saving consultation. And I don't know if you just heard my phone buzz. I just received a text message confirming my appointment and that the doctor is going to call me back on this toll-free number. So I need to make sure that maybe I need to add that or be looking for at 3 o'clock on Monday, a toll-free call coming in. So just as easy as that process is, I can go in and do the same thing for any of these other benefits, right? So this will give someone their own dashboard, their own access, and to be able to, and this is just on the website. We also have the exact same thing on Lyric Health, the mobile app, or somebody just wants to call at the bottom of here is the 866 number, toll-free number into Lyric Health. So they have 3 ways to contact us, either the 24/7. They also have their member portal, and they also have the mobile app. The last thing that I'm going to cover on this is that this is a full bilingual English and Spanish experience. So if someone comes in and wants to have this entire experience in Spanish, they can actually toggle, and this is set up whenever they come in and do their activation. They'll be able to select which language they like. But this is actually within the code itself. As you see, Google's trying to translate this. We don't want Google to translate that stuff for us, right? So everything within the code is actually set up, and we'll then set up a Spanish-speaking doctor to call us back or make the appointment with. So that also then puts their favorite language in there. So any communications or anything that goes out to them will be in the language in which they would like to speak.
Hey, Wayne, a couple of questions. Gary asked, if the client doesn't have an email, what should we do? Because I know that's how we typically communicate the emails and the welcome letters and everything to the client. So what happens if they don't have an email?
So if someone needs to, not have an email, we can still accept their enrollment. However, they need to know that the communication, as you said, Steve, will not be going out, to them. They would have to then log in themselves to the member portal and be able to log in that way. So hopefully they have some kind of Gmail account. I know that we've worked with a lot of organizations that have that same question. And we recommend to them to, if they've never set up a Gmail account, just simply show them how to do so. It takes about 5 minutes to get it set up, and it will be something that, we'll be able to communicate back and forth with that member at a much higher success rate than if they don't have an email at all.
Great, thanks. Gary also asked, if members are traveling from state to state, my understanding is they can use this anywhere in the country, even if it's not their resident state, as long as they're specific as far as where they are when they're requesting that service, so that they do get a state licensed physician, right?
Correct. So we're licensed in all 50 states. We actually even have doctors in Puerto Rico, based off of a project that we have down there. And so if someone is traveling, they can be assured that they have 24/7 coverage no matter where they go. And I was actually talking to a group today about those who, may what we call winter Texans. We're here in Texas. So during the harsh winters up north, we get a lot of people that come here, and someone can actually establish a primary care, while they're on, a different state than where they're actually at, if they're going to be there for a bit. So whether that's urgent care or virtual primary care, we have them covered.
Sounds good. I appreciate that. Thanks, Wayne.
So Gary, I asked about, over the road truck drivers. Yes, we do a lot in transportation. And guys, this is where virtual primary care is to get to the folks who normally aren't engaging in their healthcare. And the reason they're not is because it's been inconvenient. So Gary, to your point, a truck driver to pull in an 18-wheeler for a wellness exam just does not work, right? So with that, they're able to use, whether that's urgent care, behavioral health, all this, they live off their phones, whether it's GPS or anything else. Well, why not get their healthcare the same way? So we're delivering this to them in a virtual world rather than them jumping through hoops. So Ron, you asked about specialists. If there is a need for specialists other than dermatology, our care coordinators will handle those and make sure that that person is able to get to a specialist, whether that is on a virtual basis. We don't have like cardiologists or anything set up as specialists within our network, but the care coordinators do make sure that if a doctor does say you need to go to an oncologist, that the care coordinator will get them there.
Okay, well, listen, I so appreciate your time, Wayne and Emily. This has been really helpful. Folks, if you want more information on the program, I would first direct you to ahcpsales.com. Go to the carrier page and look for the Lyric logo, and you'll find more information there. There's the brochure. We will eventually post this training deck. There will be a live recording available to everybody. And of course, if you do want to get contracted, you can either fill out the form online, give us a call. We can also send you a link online, whatever's easiest. And we would love to help you get contracted and start selling. If you have questions about commissions, those can all be answered by our broker support team at 877-228-8773. You'll find that number on our website as well. Take care, everybody.